Hi there, I'm Ashley Cornell, and today for my persuasive speech, I'm going to be talking about why I think that death with dignity or assisted suicide should be legalized in all states. Have you ever witnessed someone who is suffering from a terminal illness and just struggling to get through the last part of their days with no dignity at all, in pain, unable to do anything for themselves, and you just can't imagine going through one day with what that person is dealing with, let alone dealing with it unconditionally until, unfortunately, you pass away. Well, one solution for that that is done is called assisted suicide, which allows patients with terminal illnesses to decide when they want to die, and they are given a drug that they take when they're ready and are able to pass away with the dignity and respect that they deserve. And so it's a very controversial subject, and one I know that you don't change your mind overnight over it. So I'm hoping by the end of this presentation I could, if you're on the other side of the decision, I could give you some insight and a little bit more information to help you with your journey on what you think is right. And so starting out, in order to receive the drug that is lethal, it's not an easy process by any means. You have to go through many steps in order to receive it. And so starting as of September 2019, the aid and dying statutes are in effect in California, Colorado, District of Columbia, Hawaii, Maine, New Jersey, Oregon, Vermont, and Washington. And this is according to deathwithdignity.org. And you have to be 18 years of age or older and mentally competent or capable of making and communicating your healthcare decisions, and you must have been diagnosed with a terminal illness that will, within reasonable medical judgment, lead to death within 6 months. And also, you must be able to insert yourself, self-administer, or ingest the prescribed medication. So you cannot receive help from a family member, a friend, or anyone else. You have to do it by yourself. And my next point that I would like to make is that I feel that when making a decision this monumental, it's a personal choice. And from a citizen's view, I feel that it should be an option that all states should allow. And explaining a story from CNN about a father and a son, and it was reported that David Goodall was a 104-year-old Australian scientist who flew to Switzerland in May, and he was able then to have a team of doctors end his life. And the reason why that was done was because his health was deteriorating at a very, very quick amount, and he was no longer able to enjoy the life that he once lived. And his son explained that before he wasn't 100% on board with the idea of it being legal to medically end your life, but after seeing his father become futile and unable to take care of himself in just a state that he had never seen him in before, he quickly changed his mind. And it was stated by him that he came to realize that at a certain point, sadly, life not be worth the immeasurable suffering of an alternatable disease. And so going on, one of the most seen arguments I've seen in this case is that these days no one needs to be in pain. And according to euthanizedebate.org, it is legal for a doctor to prescribe as much pain medication as needed to make a person comfortable, even if this may hasten their death as a side effect. If the doctor's intention is to relieve symptoms and not to kill the person, it's not euthanasia. In rare cases, 1 to 4%, where pain medication is not enough, a person can receive reversible palliative sedation. But what I have to say to that simply in return is that patients don't want to see their loved ones burdened by expenses that are holding off the inedible. And according to Kevin MD last year, Medicare paid $55 billion just for doctor and hospital bills during the last 2 months of a patient's life. And it has been estimated that 20 to 30% of these medical expenses may have had no meaningful impact, unfortunately. And most of the bills are paid by the federal government with few or no questions asked. And a final point that I have is just simply that these terminal patients don't want to see their loved ones seeing them in a state of just not being able to take care of themselves the way that they did, and deteriorating into a point of they can't walk, they can't dress themselves, they can't feed themselves, and it's really pathetic for them. And according to an article in the Houston Chronicle, Judge Reinhart ruled on this issue, saying that a competent terminal ill adult having lived nearly the full measure of his life has a strong liberty interest in choosing dignified and humane death rather than being reduced at the end of his existence to a childlike state of helplessness, diapered, sedated, incompetent. And I feel that being able to make that decision for yourself will save, in the end, a lot of grief than having your family members see you in that state. And so, in conclusion, I feel that assisted suicide is, in other words, a graceful ending. And being able to decide that for yourself is the most respectful thing we can do for them. And it having it legal in all states would allow those that feel that they need that right over their own bodies, and it would make it easier on family and friends. And for the rest of the audience, I encourage you to maybe look up your own information, think about it, and maybe change your minds if you were thinking in the other direction before this. And so thank you, and have a good day.